tablet for 100 days at a go. And who is going to deliver this medicine? Who is going to ensure compliance? So what we realized simply was, it's a compliance issue. Unless we find the right medicine and somebody to supervise this doses delivery, we can't do this. To take it a little forward, we collaborated with a large manufacturing company, with large pharma company with a turnover in the excess of 600-700 crores. I met with the CEO. I asked him, is there no solution after 60 years of our independence? Do we still need to give this 5 paisa iron folic acid tablet which nobody wants to take? He said, no, surely we have. There is a syrup called Inferon, which is iron folic acid plus absorbic acid, etc., etc. And this can have miraculous effect on kids. And I said, what is the taste? He said, this will be lovely. It will look like, as if kids are enjoying a drink. So 84 rupees equivalent bottle. They gave us at a cost price, which was about 28 rupees, or actually probably below the cost price at 28 rupees. Suddenly we had a wonderful solution. Now, when we delivered this medicine to the young toddlers, 3-year-old child in the Aggarwal's, 6-year-old child in the first class, when the medicine was being delivered, these young kids, they will just open up their mouth. They were waiting for this medicine to be popped into their mouths. So it didn't become a pain for the teachers to deliver the medicines. So there was no howling. For 100 days, seamlessly, all these kids took the medicine. And only last week I got the end-line survey done. 99.4% compliance. In some cases, compliance is 103 days. So instead of 100 days, some kids have gone ahead and taken medicines for 103 days. And the impact, 70% of these kids, 6,000 kids, this was not a small sample, 70% of these kids are already showing remarkable improvement in hemoglobin, which is 1 to 2 grams. 17% are showing more than 2 gram increase in their hemoglobin. This is in the process, and whereby you can have your exit model also. What are the kind of innovations that you like to bring in? Innovation is not necessarily only the product. It could be in the processes. It is how you engage the communities. It is how you deliver the program, how you bring partners together. Can you create a multi-stakeholder partnership where everybody brings whatever best resources they have? It's not always about money. I'll give you an example. How we are able to scale up our eye care program. Red Cross gives me a vehicle and the fabrication cost. Rotary gives me the entire pathological and eye care equipment worth about 1.5 million rupees. Lakshmi Eye Care Hospital, which is a large hospital facility in Panvel, somewhat suburban Mumbai kind of area, they have committed to conduct 5,000 cataract surgeries every year for us, free of cost, including to and fro transportation for the patients. We worked with another company to find out prefabricated, pre-powered spectacles. Initially, the cost was $200, but a lot of haggling, negotiation, bringing those commercial skills into the NGO world at unbelievable price of sub 50 rupees. We are getting the prefabricated spectacles. So whether it's a minus number or plus number or whatever, in some colors and variety and unbreakable kind of specs. So you romp up your feet on the spectacles don't break. This is the kind of thing and technology we need for our communities in the rural areas. So how do we scale it up further? We signed up the MOU with the hospital. We said, we are going to reach out to 70,000 people in this year, and which will mean, going by the baseline data they've collected, almost 30,000 people will need spectacles. Are you prepared? So can we create backward linkage for you? We'll need about 5,000 to 7,000 cataract surgeries. How can we help you scale your activities? Can we get you best equipment, etc.? We did a little more research. We found out that one of the companies, Chennai-based company, is Officer-Swades, which does wonderful job about eye care equipment, etc. We got 40% cost reduction in those equipment, so forth and so on. So effectively, a program which is going to cost me about ₹1 crore a year, with this kind of multi-stakeholder collaboration, my out-of-the-pocket cost is going to be about 20 lakhs. But more beautiful part, more than the money, is that with this kind of ingenuity and like-minded people coming together, a Lakshmi hospital, which was doing only 4 camps of about 150 people each a month, we are able to reach out to 50,000 people in a year. A Lakshmi hospital, which could do only about 120, 140 surgeries in a month, we are talking about 5,000 to 7,000 surgeries in 1 year. And we are tying up with similar hospitals, looking at the capabilities, etc. So how can we bring these kind of partnerships into the play? A quick survey of corporates have already shown that, so the survey was done some time back, of the corporates which are indulging in the CSR, which are the preferred areas of investment. Almost half of them said education, and equal half kind of said health, followed a smaller percentage on water, sanitation, or even agriculture and livelihood, etc. So health is amongst the top priority for the corporates to work upon. However, as Mr. Bhaskar Chatterjee was mentioning, there's no idea of what kind of money is getting pumped into this. How can we create synergies for all the corporate investments and the government investments which are coming into the domain? If the investments were rightly channelized, we won't have a situation where 70% of healthcare cost is still borne by individuals like us. And I think all of us are fortunate enough to still bear that medical cost. Look at 70% of your population living in rural areas, 68% of your population living on sub $2 kind of income level, etc. If they are forced to pay 70% or more of the healthcare cost, can they sustain? There are enough number of studies to tell us that, a major sickness in a poor family can spiral them down into utter rut of poverty forever. So 30, 40, 50,000 rupees spent on a major illness in a poor family is a kind of assurance that this family in their lifetimes will never be able to get out of the poverty. So can we channelize the resources in the right direction? Can we push government to scale up the health budget from about 3.54% to about 6%? But that's not the discussion for this forum. However, can we channelize our investments as businesses and NGOs in the right spaces, collaborating with each other? I've already mentioned nutrition is not even taught. There's no health-seeking behavior. We did a study, baseline kind of study of almost 600 villages, every household, every opinion leader, etc., that we consulted in those villages. And we made them to list out what are the major issues and your aspirations. So in terms of issues, there were issues about sanitation, there was issues about livelihood, migration from these rural areas to Mumbai, Pune, Surat, etc., and so on and so forth. In terms of aspiration, youth was aspiring for IT-related white-collar jobs, etc. Ladies were expecting better education and awareness about RTI, STI, sanitary napkins, and those kind of things. But all these kind of things, health-related things, were nowhere in the top 10. They were not in top 20. So there is no health-seeking behavior from these communities, because for most of these impoverished people, and 68% of such India, it's still a question of roti, kapda, and makan. It's still a question of basic sustenance. So how do we work together to create that kind of demand for right health and nutrition amongst our kids, mothers, particularly young girls? And so this is a challenge that we can work together. So where are the areas of collaboration? So first and foremost is change the mindset of our communities, our people, the NGOs, the corporates. We are not necessarily required to work only in the curative aspects of health and nutrition. We need to look very actively to work upon the preventive aspects, building the entire ecosystem where right from -9 up to 2 years, and then 2 to 11 years of child's growth, and going forward when the boys and girls get into adolescent ages. So if we bucket them into these 3 or 4 categories, the youth, we work on their health, nutrition, awareness needs, we align them, what is right for them, what is not right for them, and we work with their mothers back home to ensure that kids are getting the right diet, they have the right hand washing practices. How do we create a synergy between health, water, sanitation, and even agriculture to be able to provide right kind of diet? I think right now we are looking at health in isolation. We don't see education playing any role in right health and nutrition. We don't link up right availability, right and quality availability of water in the people's homes. We don't look at sanitation being as one major reason for people getting ill or causing groundwater to be contaminated or the fields to be contaminated, etc. How do we focus more on most disadvantaged people in terms of healthcare, which is whether people in tribal areas, hilly areas, or arid lands where there's hardly any water, etc. So people are not able to live the healthy quality of life, which otherwise we are all blessed to live in. Another important challenge that we are facing so far is my scalability has increased tenfold. I don't have a fear of pricking a child or doing something wrong. As a result of this, my community health volunteers, which are 7th class women, 7th class passed women, or sometimes men, or even untrained people, they can undertake these kind of tests without any medical or ethical issues. And suddenly, my anemia program is looking like taking a scale and a shape. So we need corporate investment to come into these kind of researches, helping those kind of companies which are incubating these ideas. We need a lot of such point of use technologies, interventions, whether it is telemedicine, whether it is trying to find out blood tests. I understand VOCAD, I see the name here. I think VOCAD has come across a technology in which with a single blood test you can have some 30-35 parameters of blood tested at a cost of about maybe 2 rupees or less, something like this. So we need some of these technologies. So friend, to wind it up, I just want to leave you with the thought that this is a huge challenge, and if we really want to make a difference to our country, health is one area, health and nutrition, that we should all collaborate, all right-minded people should come together. There's no space for competition in the NGO world. We should share our best practices learning. There's nothing required to reinvent the wheel. There's enough and more happening across the world. I think we should be open, share our failures, our successes, and work with each other. Corporates, they have a lot of skills to collaborate with us. They need to know. I've been on the other side as a corporate, so we need to know that sometimes NGO can't match with our pace. We don't have the infrastructure in the NGOs which a corporate might expect. A corporate, I've had a situation where as a corporate, I demanded an NGO to give me 5 color printouts of a voluminous presentation. And this person simply very politely said, Praveen, is it required? I said, yeah, I'm getting some VIPs to drop into my office and I need this. Without realizing that one deck of such presentation would have costed this NGO about 1,000 rupees, because they were about 40 or 50 pages, and 5 decks, and I was unnecessarily making them spend 5,000 rupees. So it's in corporate, if we can understand some of these challenges that the NGO or social development sector faces, and we work on these, we capitalize on each other's strengths, that'll be ideal. Thank you. Thank you.